Hey guys, so today we're going to talk about the Kaplan's decision tree. And I know this says RN decision tree, but it relates really well and works really well in your PN courses as well. Okay, so that's why I like sharing it with my PN students. So Kaplan is just a test solutions company. I know I'm pretty sure y'all probably have heard of them before. I think some of the Fortis campuses utilize them. Other Fortis campuses utilize Saunders. But they make really great test taking products to help prep students for like the NCLEX. I used them after I graduated nursing school, did their program and passed my NCLEX the first time, no problem. And one of the things that they did give us was this Kaplan's decision tree that we're going to go over here in just a minute. And the Kaplan's decision tree is a really great tool to help with those priority questions, like those questions that are asking you as the nurse, what do I need to do first? What is my focus right now? You may have answer choices that you think, oh gosh, I need to do that. I need to do this. I don't know which one I would do first. So it really helps you as the student develop good critical thinking skills. So you're able to get more at that Bloom's taxonomy of analyzing and applying the material. That's really what it's getting you to do. It's getting you really good at critical thinking. When I went through the program for Kaplan, I remember thinking to myself, dear God, I wish I had had this stupid tree while I was in nursing school, because it's not just for NCLEX. It will help with exams, your nursing exams, ATI, HESI, um, NCLEX, all of it, because it's really helping you break down that information. So let's go over what the tree is, okay? So there's several steps to the tree, and in order for this to work, you're going to get really good at practicing utilizing it. So I'm going to go over the tree, and then we're going to go over some sample questions on how to utilize the tree, okay? So our first step is, can you identify the topic of the question? Now, I also like to include the stem of the question, and I'm going to show you how to do that in some sample questions. 2, are the answer choices assessment or are they implementation? 3, are the answer choices physical or are they psychosocial? 4, are the answer choices related to ABC? Now, why is these next like little 3 steps, 2, 3, 4, are so important? It's because we know that with step 2 in our nursing process, right, it's important for the nurse to assess first, right, before she implements. We know with step 3, physical answer choices are going to be higher on Maslow's list than psychosocial. We also know if any of the answer choices are related to airway, breathing, and circulation, that also puts them on a higher priority list for us as the nurse to do, right? So the reason why 2, 3, and 4 are so important is it's helping you break down those answer choices. So hopefully we can start eliminating wrong answer choices. Once we've done that, we want to look at what is the remaining outcome of what's our rationale for each answer choice. Okay. What is the outcome of the answer choice? Okay. So we're looking at that. And then if we could only do one thing and leave for that patient, what would we do as the nurse? Okay. Now I would also like to add 2 other things. Whenever you pick your answer choice, remember your answer choice is always going to match the topic or the stem of your question, okay? So it's always going to relate back to that step 1. Second, when you are looking at your answer choices, don't think this is the right answer, because I see students do that. I've been tutoring for a very long time. And what I see students do, the first thing they want to do is they want to pick out that right answer choice. Don't get in that habit. It's probably already there. What you want to get in the habit of is picking out the wrong answer choice, because that's what you need to do first. You need to go in there and it's like, this answer choice, it's wrong. I've gone through my steps, my Kaplan decision tree. This answer choice is wrong. I can eliminate it. This answer choice is wrong. I can eliminate it. Hopefully that will get you down to answer choices. That's really good, right? because then you're really looking at what's my rationale for each answer choice. And if I could only do one thing and leave, what would it be? Now, I said earlier that the Kaplan tree, it works really well with priority questions. Now, you can use it to help with other question types if it's not a priority one. It can kind of help you break down um, the question a little bit, but it's best used for these right here. What is that first thing that we're going to do for this patient? So let's go through a couple of sample questions. We're going to do 3 together. So that way you can get a good idea of how to utilize this Kaplan decision tree. Okay, so first, we have the licensed practical nurse in the emergency department is caring for a client who was assaulted and sustained a blunt force injuries to the chest and abdomen. Which priority client data would the LPN immediately report to the registered nurse? Okay, so it's like, what is this PN's priority action that he or she needs to do? So, what is our topic, right? Our topic is blunt force injury to chest and abdomen, okay? That's our topic, okay? That's our physical topic. What is our STEM? Our STEM is going to be priority data for blunt force, I'm going to say trauma to the chest and abdomen. I know it says injury, but every time I think I hear blunt force, I think trauma. So that's our STEM. So now let's look at our answer choices. We have pedal pulse of 2+, tracheal deviation to the left, capillary refill time of 2 seconds, ecchymosis noted on the chest and the abdomen. Okay, so we're looking at now, are the answer choices assessment or are they implementation? So you'll note that all of these answer choices are assessment answer choices, right? It would be, we noted that they had 2+ pedal pulses. We checked their trachea. We're looking at their capillary refill. We're assessing their abdomen, no ecchymosis. Okay, so those are all assessments. So implementation does not apply here. That's okay. Move on down to Maslow's. Are they physical? Are they psychosocial? We know that all of these answer choices are physical. Okay, so there's no psychosocial that we can eliminate. Now we go to ABC. Are any related to airway, breathing, and circulation? Yes, right? We know that pedal pulse of 2+ is related to circulation. All right. We know that tracheal deviation to the left is related to what? Airway. Capillary refill time of 2 seconds is circulation. Ecchymosis noted on the skin and abdomen is not related to ABC, so we can get rid of that one. So now we're down to 3 answer choices, okay? So what is our rationale, right, for the remaining answer? Now, we got to remember, we're looking at what's our priority. What are we going to tell that RN first? Are we going to tell her the pedal pulses are 2+? No, because that would be normal, right? Get rid of that one. That's not a good one. Tracheal deviation to the left, capillary refill time of 2 seconds. When we know airway is going to trump everything, right? So we know we need to immediately let her know that the tracheal deviation to the left, because that can be a compromised airway, right? So whenever you're doing your practice questions, okay, please do not just think, oh, I got it right, and skip on to the next answer. Question. I want you to get really good at reading every rationale, if it gives you that option, as to why that answer choice was correct or why that answer choice was wrong. Because what Kaplan teaches is you got to get really good at reading the rationales, because when you're reading the rationales, it's getting your brain to think, like the test, it's getting your brain to think critically, okay? And it's giving you those little tidbit of informations. And that's why when you do practice questions, it gets you you're gonna perform better on your nursing exams. You're gonna perform better on your NCLEX. There's no shortcut to passing the NCLEX. It comes through practice. These types of questions you get on any online thing about, it doesn't matter if it's Saunders, Archers, UWorld, Kaplan, whatever, they're going to tell you the key to success is doing practice questions. So let's go ahead and read the rationale. So attention pneumothorax is what? It's an emergency, right? It's where air enters the pleural space and can't escape. This is what's causing, right, that tracheal deviation to the left, okay? Because now we know that they have compromised oxygenation because it's compressing the unaffected lung, all right? So that's the reason why it's going to be the most important answer choice, because it's related to airway. Let's see. Options 1 and 3 are normal assessment findings, right? We talked about that. Option 4 is an expected assessment finding to blunt force trauma, right? We would expect there to be some bruising. Now, let's look at these like here. We know that the client's needs were psychological integrity, FYI. NCLEX will test you on different categories, and one of them is psychological integrity. Now, let's pop on down to here. Level of cognitive ability, analyzing. What does that sound like? That is Bloom's taxonomy. That's the reason why I did the video on Bloom's taxonomy. If you haven't listened to that one, please do. So it's testing, this question is testing your ability to analyze the information and to think critically about what I need to do for that patient. So that's the reason why I like to go over Bloom's taxonomy so much, because it's really giving you that good information of why you're being tested on the level that you are and how you can change your study habits to be more successful. Also, we said that our STEM was going to match what our answer choice. So priority data for blunt force trauma is going to be tracheal deviation. That's going to be the first thing that we do. That's the reason why it matches. That's the reason why it's the right answer choice. Okay. Let's go on to another one. All right. The nurse employed in an emergency department is assigned to assist with the triage of clients arriving to the emergency department. Okay. The nurse should assign priority to which client. So our topic is going to be like a triage event, right? And our STEM is priority assignment for triage. It's really hard to break this one down a little bit, but it's just going to be that priority assignment for triage. So you're in the ER. All it's saying is which one of these which individual are you going to see first? Okay. 1, a client complaining of muscle ache, headache, and malaise. 2, a client who twisted their ankle when they fell in line skating. 3, a client with a minor laceration on the index finger sustained while cutting an eggplant. 4, a client with chest pain who states they just ate some pizza and that was made with some very spicy sauce. Okay. So are the answer choices assessment or are they implementation? Well, we know that they are assessment, and we know that it is subjective data because it's what the client is telling us, right? Or some of them are subjective and some of them is objective, but it's what the client is telling us for the number 4. So we know implementation does not apply. Okay, going on to Maslow, excuse me. Are they physical or are they psychosocial? They're all physical. They're all physical injuries. We're trying to figure out which triage person we're going to see first. Okay. Are any related to ABC? Client complaining of muscle ache, headache, and malaise? No. Twisted ankle? No. Minor laceration to the index finger when cutting an eggplant. I mean, I don't think I would read into that one as much as say circulation. Chest pain. I know they just ate the pizza, but chest pain, yes, that could be related to ABC. Okay. What's the rationale? Okay, so a client complaining of muscle ache, headache, and malaise, that's important, but are they our priority if we have somebody with chest pain? Probably not. Twisted their ankle while falling, they ain't gonna die from that, right? So they go down on the list. A client with a minor laceration on the finger, one cut an eggplant, that's not gonna kill them. They can wait a little bit. Client with chest pain who states they just ate pizza that was made with a very spicy sauce. Now, you may deduct that that possibly is GERD, and it may be, but we can never just rule out that chest pain, is related to GERD without doing a further assessment, right? We know that's going to be the top physical need at that moment. These other people can wait until we see this gentleman with the chest pain, okay? And if we could only see one person and leave, who are we going to see? We're going to see the dude who said, I had some chest pain. I ate some spicy pizza. Okay. So when we're reading our rationale, okay, we know that chest pain is going to come first. Okay. Clients with conditions as simple as fractures, asthma without respiratory distress, fever, hypertension, abdominal pain, or renal stones have urgent needs, but they're going to be classified as a number 2 priority, okay? Because number 1 is going to be chest pain. Clients with conditions such as minor lacerations, sprains, cold symptoms are classified as non-urgent or number 3. So the reason why you would want to read this rationale is this piece right here, because the next time you get a triage question, hopefully, since you've already read this rationale, you're going to remember what's priority 1, what's priority 2, what's priority 3. So that's one of the reasons why it's so good at reading the rationales when doing practice questions. Let's scroll down. It's looking at safe and effective care environment, level of cognitive ability, applying, right? What is that application level of knowledge? Can you think critically in a triage situation? That's the reason why they like to test this like this. Okay, let's get one that's a little bit different. A client has reported that crying spells have been a major problem over the past several weeks, and that the doctor said depression is probably the reason. The nurse observes that the client is sitting slumped in the chair, and the clothes that the client is wearing do not fit well. The nurse interprets that further data collection would focus on which assessment. So your topic is going to be depression, right? Because there's automatically we are alluding that depression is the issue. We have some physical symptoms of depression, right? So our topic is depression. Our STEM is going to be depression assessment. Okay, what is that? Because that's what we're looking at. That's what it's asking us. What else are we going to talk about with depression assessment? Okay. So we're looking at our tree. Are these answer choices assessment or are they implementation? These would all be assessment or any physical or psychosocial. Weight loss is physical. Sleep pattern, we're going to say physical. Medication compliance and onset of crying skills, we could put that in the psychosocial, right? Because medication compliance relates back to knowledge level that the client understands they need to take their medication. Onset of crying spells. Crying spells is a psychosocial need. So it's not necessarily a physical, not the top. It's due to sadness, right? Physical crying spells are due to sadness. So that's the reason why we put it in the psychosocial needs. So that narrows it down to weight loss and sleep patterns. Okay. Hope that helped. Are any related to ABC? No, none are related to ABC. What are the rationales? Well, we know that we said that the clothes don't fit well, okay? And we know that they have depression, and what's going to be that further assessment we're going to focus on. One way to utilize this is when you're looking at a couple of answer choices that you've eliminated with psychosocial, you know you're using Maslow's, is which one is going to cause the most harm. I like to rephrase it like that because if you do that, then you're going to think, oh, shoot, weight loss is the one that's causing most harm, right? Because they're not eating well. They're not eating and drinking well. Okay. Um, so that's going to be the first thing that we're going to look at versus sleep patterns. So when you break it down like that, like which one is causing the most, can cause the most physical harm, especially with these mental health type questions, it's gonna really help you categorize it because I can understand how it'd be easy to think how why onset of crying, right? Because for a DSM-5 criteria diagnosis for depression, major depression has to be occurring for 2 weeks, right? The doctor's already alluded that it's probably depression. But we really want to look into that weight loss first because that's the one that's going to be causing the most harm at that time. Because if they've lost 20 pounds, that's a lot of weight and they're nutritionally deprived. Okay. We know that weight loss matches our STEM and topic for our question, right? And if we could only do really one thing for that client, one assessment piece, right? We're going to look at the physical first, which is going to be weight loss. So weight loss is the first item that needs to be further data because ill-fitting clothes could indicate a problem with nutrition. The client already told the nurse that the crying spells have been a problem. Okay. Medication or sleep patterns are not mentioned or addressed in the question. So that's how it shows that it doesn't necessarily match. That's another way you could have eliminated those is it doesn't necessarily match what we said in the question. Let's look at what its cognitive level is analyzing, right? So it's looking at your analytical skills. Okay, let's go back to our tree. So that is the Kaplan decision tree. That's how you use it. Please get really good at practicing this tree. We're going to talk further on other episodes about utilizing the nursing process, how PNs can utilize the nursing process. But for now, just get really good at using your tree. You can get this tree online. It's free. If you would like for me to email it to you, just let me know in a message. Through my Fortis email. Y'all can look me up on there. It's sierra.pickering@fortisinstitute.edu. But I'm happy to help any student learn this process and get really good at applying it. So hope this helps. You'll have a great day.